Hello and welcome to ComplyPlus Presents. We're here again with a new special guest this week. I'm delighted to introduce you to Abby Manga. She is a fertility nurse specialist, a health educator, and a John Maxwell coach, speaker, and trainer. Abby, great to have you on the podcast.
Thank you for having me. It's a pleasure.
No problem. So, we're going to look at a few different themes with Abby today. Sort of look at her career to date, see where it all began, and also what the future holds for Abby and the sector that she's currently working in, which I'm sure will relate to a lot of our listeners and people within our network. So hopefully it will be a really interesting episode on many fronts. So Abby, from your side, could you tell everyone about your sort of upbringing and early influences? Where were you born? How did it all start? How did you get onto this journey into nursing?
So I was born in Zimbabwe.
Okay.
Some many years ago.
And we don't need to know the specific date, don't worry.
So, I was born in Zimbabwe, raised in Zimbabwe. I left Zimbabwe when I was 19. They were about 19 after I finished my A-levels, and then I came to the UK and went straight to nursing. And I had initially wanted to study law, but when I saw that my grades were not that great, then I switched to accounting. So I was trying to find a university that would take me in the UK to do accounting.
Okay.
But somehow found my way into nursing instead.
Okay. Yeah. So that's how you got onto your journey in nursing. Okay, very interesting. So how, from going to nursing, what drew you to fertility later down the line? What drew you into that area?
So I would like to think that fertility just found me. I initially had no idea what fertility was. I saw a job. I wanted a change. I had been working in medical admissions for quite a while, and I wanted a change, and I saw a job in IVF. So went for the interview, and when I was at the interview, that's when I actually had got more knowledge of what it all entails, but loved it. From then on up to now, I can't see myself doing anything else other than what I do.
Okay, excellent. So was there a moment that you realised fertility support wasn't reaching everyone equally when you were on that journey?
So the first thing that happened was in the world of fertility, if you don't interact outside of it, you wouldn't know a lot about the inequalities that are there, because you're just seeing the patients that are coming through the door. So I went to an event which was a Black-led conference, and whilst I was there, people started asking me what I do. And when I explained what I do, then a lot of questions came out of that, which then made me realize that, one, there's a lack of education within our community. And then this was years before the HFEA report. HFEA is the Human Fertilization and Embryology Authority that governs the IVF or fertility sector. Okay. So the report came, I think, 2022, and it shows the same disparities some of the disparities that I had picked up from just having conversations with people. Okay. So obviously on this journey that you've been on, what sort of are some of the key career milestones you've had both in the NHS and obviously the private sector as well? So I started my NHS journey in 2003 and progressed through the grades.
Okay.
And then when I went into fertility, I was in the NHS initially, and then I decided to leave the NHS and went and experienced the private sector. And whilst I was in the private sector, I had the privilege to set up a new IVF clinic alongside one of the renowned embryologists in the country. So that was... I really loved doing that. It opened my horizon to other things besides just the private sector, but also how you set up a fertility clinic from the regulatory perspective, from teaching, from creating an environment that you want for the patients, because I was the main person for the nursing team, and I also had to train the admin team. So after that, after some years, then I moved back into the NHS, and I've been in the NHS since.
Ever since, yeah. Okay. Yeah. So how do you manage the NHS role alongside some of the coaching stuff you're doing, the advocacy work you do? How do you find that? And obviously being a parent as well.
I think one of the main things I've learned is looking at what my priorities are at that time.
Okay.
So I know that I have it's a full-time job, so I work 4 days a week, but it's more or less a full-time job.
Yeah,
so
hours-wise, yeah.
Exactly. So my other things, I feed them around my main job.
Okay.
And I do have the privilege that my children are now grown, so they don't require the same attention that they did a few years ago. They are both in uni, and that helps. That I have time to do the other things.
Okay, excellent. So looking more now into the fertility side, the culture, and some of the barriers to access, I know we discussed before we started shooting this afternoon. What are the most common fertility myths you encounter in your outreach work?
So with the myths, one of the main one is that fertility is all to do with the woman. So if there is a fertility challenge, it's perceived that it is the woman who is the issue.
And that would be the number one myth.
That's the number one.
Okay.
Yeah.
Okay.
And I've realized that it's mostly within our community. My community is the ethnic minority community, right? But it also, some communities that you wouldn't expect to have that, they also still believe that it's the woman. So you end up having more women seeking out fertility services or answers more than the men. It's a bit difficult for the guys to come to have assessments done when it comes to fertility.
So there's that sort of stigma, and maybe males not being as forthcoming in terms of getting some sort of diagnosis.
Yeah.
So how do cultural norms shape how people approach fertility support, in your opinion?
I think a lot of the issues that result around infertility within the Black and Asian community tend to be around the cultural norms. So you will find that within the Black community itself, we don't access health services early. And this is mostly from what I found out from the groups that I associate with. It's a lot to do with the fact that people will go and try and find solutions elsewhere. So within the Black community, people will go, religion is very high. So people will go, if it's church, if it is like whatever religion it is that they believe in. So they will seek that first. And then also there are others other things that within the black community, especially, that they would go to. They are, I don't know, like in Zimbabwe, we have like witch doctor type people, they're called ngangas. So they would go to those things. And this is not just people that are in Zimbabwe, but even here, you will be surprised that people still try and seek those solutions first before they even decide to go to a hospital to get checked.
Professional, yeah.
Yes. So, which means that for most of the people, they present late. And with fertility, you need to start the journey early. So, if a woman is like 36 or so, the timeline that you are left with to try is becoming shorter and shorter. And with the health system, the way it is, it means you may be in the queue for a bit longer before you actually get help.
Okay. So you've talked about cultural pressures. What other sort of misinformation do you commonly see? In terms of people, like you say, I know you've mentioned some references there where people go to seek, via maybe religion, for example. But are there any other examples of sort of misinformation that you hear or that you've experienced?
So witchcraft is also quite high, where people think that they have been bewitched. So hence the need to seek solutions elsewhere before they come to a health professional, because they are thinking it's something that's spiritual that needs to just be sorted out from a spiritual perspective. And I think also the other issue that happens is, as I mentioned, for men, for a lot of men, especially within our culture as Africans, it's very difficult for them to admit that something could be wrong with them and for them to agree to go and get checked. The woman sometimes goes by herself, but the man is not very forthcoming. The good thing with the UK system, the NHS system, is when you present to us, we will ask that the man comes along. But it also eliminates some people. If the gentleman decides not to come along, then it means that the woman may not end up getting treated.
Getting the support, that they need. So what is your sort of approach to awareness raising on this sort of topic? I know you do things like the storytelling. I know you also do some public speaking as well, don't you? So what is your key sort of approach in addressing these sort of cultural differences and misinformation that's out there, or even, like you say, on places like social media, the internet, and everywhere else?
So I have social media platforms that I use to educate. I have used Instagram, TikTok, and I have a WhatsApp group that I have with nearly 300 men and women. It's mostly women, but it's a mixture. And I use those platforms to educate. You will be surprised some of the things that people come up with, or the misunderstanding that they have, maybe because I don't know, because I'm assuming people have gone through biology at some point, but there is still, where people are. Recently I had a question of, so when I have a period, does that mean that the egg has broken? Do you understand, when you have the hen egg that we normally know, so they're thinking in their head that the period is, menstrual period is coming because that egg has broken.
Egg has broken inside.
And which is not correct. From a biology perspective. So you have to try and explain to people how the menstrual cycle, so that's the teaching, how the menstrual cycle works, how your body works to get to that point where you have a period, and how your body works for you then to try and get pregnant. Because I have also encountered couples that only have sexual intercourse once a month, and they are asking me, how is it that we are not getting pregnant? And you're like, you should be having regular intercourse for you to get pregnant. Because in their heads, in their minds, they're just thinking, you just need to have intercourse however, whenever, and it should just happen.
And it should just naturally happen.
Yeah.
But that's obviously not the case. I think you've sort of gone on to my next question on this sort of area, which is, are you currently delivering any training programs around women's health or fertility?
So I don't have a program yet. I am working on a program around ovulation, because I have realized that that's the basis. We need to get people to understand about ovulation, and then understand how ovulation and then intercourse works in relation to you getting pregnant. So it's something I'm working on, but I just do the teaching that I do on the platforms that I currently have.
On the platforms you currently have,
Yeah.
Okay, brilliant. So now I wanted to sort of look at the innovation side and the future of fertility care as you see it through your perspective. So what is your sort of vision for virtual ovulation induction clinics? I know that's a topic that we discussed when we were sort of preparing for this podcast. So maybe you can tell us more about that idea and what that might look like.
So with a virtual ovulation induction clinic, that would be my idea, right? Is that patients don't necessarily need to wait for treatment for that long. So with ovulation induction, they can just have their fertility assessments done. And if the men, if they're both fine, there is nothing that we are seeing that means they need IVF, or we know that they have some conditions that are causing them not to ovulate naturally, then without wasting a lot of time, then you start treating them. And they don't necessarily need to then go to like a physical clinic for that, because you can assess them. Once you have the results, you can assess, and then you can give them treatment. With the specialist nurses, so some of the fertility specialist nurses have prescribing courses. I'm one of them. So, which means with the proper structures in place, you can then do that, and they don't have to go through the normal everyday channel that they have to go to the doctors, as long as we have the proper structures that will help us to deliver that care to them. So which becomes a nurse-led clinic rather than a doctor-led.
Doctor-led. Oh, okay. Yeah, I think that could definitely something that could take off. So one other area that we discussed when we were looking at this podcast was things like coaching and leadership support for women in healthcare. I know that's another big thing from an innovation side you want to sort of look at. So where do you see coaching making a real difference in that side of things for women in healthcare?
So for the couples, I would say, not just the women, but for the couples that I encounter, maybe not just the couples, the people that I encounter with fertility challenges. One of the things that I have also noticed is some of them, they stop their lives to pursue having a child. So the coaching comes in to help them to start looking at other perspectives of life rather than just focusing on, I want to have a child, so that, whatever decision at the end or whatever outcome they have at the end, they still have a life outside of just trying to have.
Just focusing on that sole priority in a way.
Exactly. That there is, you need to look at having intentions outside of just trying to be a parent.
Yeah. So that obviously covers the sort of, like you say, patient side, coaching, but what about the professional well-being side from a coaching perspective? What are your, what sort of support do you think could be put there for people like yourself and some of your peers that are doing the work that you're doing?
Oh, yeah, because fertility, it's very emotional. It's not physical for us,
No.
but it can be very emotional for us as professionals. So in my department, I'm a well-being champion. Which means I look after the well-being
of
of
job to actually do that.
Colleagues. So some of the things that I encourage people to do is, one, we have counseling which is offered by the trust.
Yes.
So to access that, we have gotten them to come into our department and just try and support people that needed to be supported at different times of our journey as fertility professionals. And also just trying to support each other from internally. So I go around making sure that people are okay. I have referred people to occupational health where I've realized that someone needs more support than what I can offer them from an emotional perspective. So also just having things like team building activities, that has also helped us in discussing some of the incidences that would have happened that could cause someone to become distressed from, the interaction with patients.
Okay, excellent. So what do you see the opportunities being for innovation inside and outside the NHS for fertility?
So I think some of the things are things that we're already doing, but I think one of the things is looking at it from an equalities perspective. The Black and Asian community are lagging behind when it comes to fertility care. And I think it's more than raising awareness for us, because the awareness is there. There are a lot of people that are now coming out and talking about it. But it's breaking through the cultural barriers that we have. When we break through those cultural barriers that we have, I think it will become easier for a lot of people to access the care that they need. At the moment, it's just the awareness is there. It's we're starting to raise a lot of awareness, but it's just finding a way to break through the cultural barriers so that people actually have an understanding of what it is. I think one of the other things is also not quite understanding what IVF is in itself, which sometimes makes people be hesitant because they assume that when they walk into a fertility clinic, everyone is going to be prescribed IVF treatment in itself, but it's not so.
Okay. And my final sort of point on this was to sort of say, have you considered launching a charity or service to scale your impact so far, or what you plan to do in the future?
It is somewhere there. Somewhere
in the plan.
In the plans. I haven't properly mapped it out, but it's somewhere there.
Okay.
Yeah.
Excellent. So, obviously, you said obviously that there is a lot of awareness there, but we need to bring down those cultural barriers and break the silence, continue to have that voice. So, From your side, which platforms do you use most to connect with your audience at the moment, particularly from, say, a social media perspective?
I use TikTok. I think
that seems to be the most engaging.
Yeah, that's most engaging. And Instagram is as well, but TikTok has most engagement.
So what about professional platforms like LinkedIn?
I do have LinkedIn. I haven't used it as much for awareness reasons. I've mostly kept it more like a professional and coach some of the coaching work that I do.
Yeah, that's what I was going to say, from the professionals that you're supporting, not just the patient side. Yeah. Okay.
The patient side is mostly TikTok and Instagram, and then LinkedIn is more the coaching side of leadership that I do.
Some of the leadership coaching you do, the John Maxwell stuff, yeah. So what does it mean to you to be visible as a black woman in a clinical leadership, in the clinical leadership space? What does that mean to you?
I think a lot of the times there is not enough role models out there. So it is role modeling for that studentness that comes into my space, so that they actually can see that you can achieve a lot if you put your mind to it. And I also believe that supporting them, when I support the young students or the junior nurses, it will also help them to progress. And I use coaching a lot when I meet juniors, because I want them to start to open their mind up to believe that they can achieve a lot. So I think a lot of the times we don't have enough representation at the top, but with the ones that are there is the role modeling. When we see that role model, then it helps the young ones to see that they can actually also attain to.
Yeah, or at least get up to that sort of standpoint. Yeah. Okay, excellent. So in terms of like lessons for you, because obviously you're quite experienced in this area now, what have you learned about visibility and voice in the NHS?
Like I said, representation.
Yeah.
But when you have a voice, sometimes you have to speak out. It's not every space that will give you the platform to talk, that will give you the platform to speak, and you have to create a platform for yourself. It is unfortunate that we still haven't gotten to that point where we can say there is equality within the healthcare system for an ethnic minority person. So you have to sometimes create that space for yourself and raise your voice so that people can hear you. And it's unfortunate that most people are very good at what they do, but it's just that they are not heard. And so you have to try and create that space for yourself in whatever. So in my case, I'm creating that space by coaching the juniors that are, under me, and also speaking out about the experiences of my people based on the lived experience of the people around me, to say this is what's going on, but we need to do more.
Okay, excellent. And like I say, I think you've maybe partially sort of answered this already, but what advice would you give to others looking to lead change from the inside? What sort of advice would you give them? I know what you've said, you need to create that personal space, but I suppose I know you've managed to do it quite successfully, but how can you create that personal space with everything else going on, personal lives and so on? What would your advice be?
I think the first thing is you have to understand what your why is. If you understand why you are doing what you're doing, it becomes easier to create those spaces and to, for you, even the voice that we're talking about, for you to have that voice when you understand that. Yeah. Even be it in a leadership perspective, be it in any sector, in any situation, environment you find yourself, you have to understand why you are doing what you're doing, and that will help you to move forward. When you don't have that, it's very difficult to go forward.
So ask yourself why.
Yeah. Why are you doing there. What are you doing?
Yeah.
Yeah.
I think that's nice, simple advice.
Yeah.
So, yeah. hopefully those listening who want to lead change, that's the question to ask yourself.
Yeah.
So in terms of looking ahead for you, Abby, what are some of your goals in the next 5 years? Where do you see yourself? Where do you want to go? How do the next 5 years look?
So we've spoken about the ovulation induction clinics.
Yes.
So that is something that is top on my agenda to see how that can evolve, how we can get that to start running. And also the coaching. I love coaching leadership, not just from the professional side of things, but I also love coaching youth. So the youth, there is a lot of potential in them, and just helping them to realize that for themselves. So that is something that I'm also looking into to see how I can partner, who I can partner with, and how I can partner with other people to build that. And I hope to be running my own things then.
Okay.
Yeah.
Excellent. So, what sort of excites you, the most about the future of fertility care?
I think it is knowing that we are going somewhere to bridge the gap, the inequalities gap. We know that there are some of the issues, like I already said, is to do with access. And that also is translated in the NHS funding side of things, that we also see that Black people don't get as much funding, funded cycles as their counterparts. So seeing that the HFA is looking into that, in that we as fertility clinics, we are also looking into that to see how we can bridge that gap. We can, bring the ethnic minority communities to be in line with everyone else. I'm quite hopeful that it will, things will get better for us as...
Will get better.
Yeah, for us.
The ethnic minorities in particular,
yes.
Yeah. So what's one thing that you would want every person struggling with fertility to hear? What would be the message to them?
I think just knowing that there is support available to you. There are a lot of people that are willing to support you through the journey. And also, so this is from a coaching perspective, from a counseling perspective. Also just mentioning for those that are in treatment that it is very important for you to access the counseling that's offered by the clinics that you are having treatment with, because that will help you to navigate the journey. It's a turbulent journey, so just to navigate that. And I think support is the main thing that I will talk about. There are people that are willing to support. Don't go through the journey just by yourself.
Or be silent.
Yeah, it is not an easy journey, and it's best you have someone holding your hand along the way.
Yeah, that's a lovely message. And obviously we talked about what your plans are in the next few years, some exciting things coming up. But if people wanted to find you now and continue learning from your work, how can they find you?
The best place is through LinkedIn at the moment, yeah. Okay. So just Abby Mango on LinkedIn, you will find me. I do have my social media platforms. So I have TikTok, is Hurukuro Zembereko, which is a Shona word. Yeah. And on Instagram, it's Seeds of Hope.
Seeds of Hope.
Yeah, tackling infertility.
Excellent. We will include those when we drop the podcast anyway, so we'll put links to those for people who do want to reach out, may have any questions for you, may want to look at some of the coaching that you're doing and the work that you're doing in the fertility sector. So we will include those. And I don't know, Abby, from your side, if there's any sort of final reflections that you'd like to add. But they're the the questions that I had for you today, or the things I wanted to discuss. So I don't know from your side if there's any other things you want to touch on before we say goodbye to the listeners.
I think I would just reiterate on the need for support. So anyone who's going through fertility challenges, or anyone who's thinking of going through for fertility treatment, that it is very important to seek for support. It could be through coaching. It could be just talking to someone. I'm open to guiding people through their journeys, just having those initial conversations, so that you are not on your own. It's not an easy journey, but having someone will help.
Excellent. Well, thanks a lot for joining us today, Abby. It's been lovely to have you, and I'm sure we'll have you again at some point. But yes, as I did say before, we will be doing some more work with Abby. We'll put a lot of the contact information for Abby when this podcast goes out, and it's published on socials and on our other channels such as Apple Podcasts and Spotify as well. So we'll include the contact information there. And as always, if there is any feedback, then please let us know. But otherwise, I'll be back with Richard next week, and we've also got some other special guests lined up over the next month or two as well. So thank you for listening.